Hello everyone, this is Dr. Humanis. Today I am going to tell you an interesting story about two drugs. It's one is allopurinol and azathiopurine. Allopurinol, it's xanthine oxidase inhibitor is used in gout. Azathiopurine, as you know, it's immunomodulator used in various conditions like rheumatoid arthritis, IBD, and etc. So these are the two American scientists in the 1940s. During the time of World War II, they were trying to find out new antibiotic. So these are Gertrude Allen and George Hutchings. They got even Nobel Prize in 1988. So they were working on purine analogs or thiopurines, and they thought it to be like antibiotic introduced. But what they found out, it doesn't work as antibiotic. But they found out that it treats the leukemia in mice. So what happens in 1951 is it was the thiopurines are approved for the treatment of leukemia. That is 6-mercaptopurine and 6-thioguanine. So at that time, because only two drugs were available for leukemia treatment, that is steroids and the methotrexate. Okay, that happens in 1951. In 1957, they found out a stable compound, that is azathiopurine. Okay, for the treatment of the same leukemia. But in the parallelly, what happens is there is a work going on the natural occurring thiopurines and xanthine oxidase inhibitors. So the allopurinol was the first compound they found out as xanthine oxidase inhibitor, and at the same, what they did was they thought if we combine allopurinol with the azathiopurine, it will not only improve the efficacy of azathiopurine but also reduce the toxicity. But they failed badly. Okay, because as you know, the thiopurines, the purine analogs like azathioprines are metabolized by xanthine oxidase, and if you block the xanthine oxidase by allopurinol, the toxicity is going to increase. So there were more cases of bone marrow failure. So that's how they rejected the allopurinol use with the azathioprine. But what happens is in 1965, allopurinol was again in discussion, and they thought, okay, if not with azathioprine, but can we use allopurinol for other conditions like gout and hyperuricemia, like in the tumor lysis syndrome and all. They found it to be very effective. So the use was started of allopurinol individually. And but what happens is, so till then there was they said rejected the idea of using allopurinol and azathioprine togetherly. But in 1993, what happens is they start trials on combination therapy, especially in the cases of graft survivals, okay, in the renal transplant cases, and they found it to be effective and successfully. And in 2005, they brought this combination in the cases of inflammatory bowel diseases, okay, like Crohn's disease and ulcerative colitis, etc. So that's how now we are using the combination. But when you're using in a combination, you have to reduce the dose of azathioprine. As you know, that the xanthine oxidase inhibitor, and it won't get metabolized, there is more toxicity. Okay, now currently the combinations now also they are trying on the other gastrointestinal conditions like autoimmune hepatitis and all, etc. So this is the interesting story. Thank you.